Hey guys, welcome to another episode of the best kept secrets in healthcare. And first of all, let me apologize for not having shared this one sooner. This was actually from a couple different people requesting where does chronic back pain, neck pain come from? So I guess in my mind, it's just been so obvious for so long because I've been preaching this, I've been talking about this, I've been sharing with people that I guess it's gotten to be just like part of my life to the point where I'm like, well, why would anybody not know that? Right. So, but a lot of people don't. Obviously, there's millions of people in the United States suffering with back pain every single day. And the only reason I can assume they're still suffering is because they haven't heard this. So please share this one. This one's obviously valuable because there's a lot of people that don't know. So if we explain where chronic back pain comes from, then in the process, we will explain where a lot of musculoskeletal pains, neck pains, headaches, upper back pain, lower back pain, leg pain, hip pain, knee pain, even pain going down the arms, sciatica, pain down the legs. So once you understand this, I think it makes perfect sense. Now we're talking about chronic back pain, right? So now if you're, you know, not use someone who does a lot of work out in the yard and you go and you spend all day raking leaves, the next day you have an achy back, that's more of an acute thing. That's probably more muscular and that heals within a few days. It's probably going to go away. But if you've been dealing with the chronic back pain for years, it goes away, comes back, goes away, comes back. Well, then there's something underlying that's causing that. So you've heard of someone like bend over to pick up their toothbrush and, dang, their back went out, right? Well, obviously it wasn't the weight of that toothbrush, right, that threw the back out. There was a weakness. It just took the right movement, the right direction, and boom, it got you, okay? A lot of people have this happen reoccurringly several times a year. And sometimes it's been going on for 20, 30, 40 years. Some people just have that chronic ache, that kind of catch you, kind of almost got you kind of sensation where it's like, oh, I better be careful when I bend over, or, when I tie my shoes, it takes me a few minutes to get back up and get it back together, right? Again, these are type of chronic type situations. If you have sciatica or any pain going down the leg, that's obviously coming from a chronic sensation or chronic problem that's been there for some time. Same thing with the arms, hands, numbness, tingling. Those are chronic musculoskeletal problems. So if you understand the concept of where back pain comes from, it'll explain a lot of things. Okay. So what I want to do is I want to screen share with you and show you a drawing that kind of shows you what's happening in this chronic situation. So bear with me just a second. And we're going to go to this one. This is a full spine picture looking at you from the head down. Okay. It says, here's what's happening. So the first thing is you have to realize there's a reflex that's called the righting reflex. And the whole purpose of that reflex is to make sure that your brain always stays perfectly balanced parallel to the ground. It's the same reflex that actually would cause seasickness, okay? It's a combination of your eyes, tell you where you are in space, fluid in your ears that will serve as like a level, and then mechanoreceptors in the head and neck. They're constantly telling the brain where you are. So if you close your eyes and you're moving around, it tells you where you are without even using your eyes. You have three different resources there kind of all coming together to tell the brain where it's at. Well, if the resources get confused, like you look out on a flat horizon, tells you your body's standing still, but you feel mechanoreceptors and fluid in yours feel you going up and down, the brain gets confused. That can often lead to things like vertigo, dizziness, seasickness, motion sickness, because you get a mixed signals and the brain gets confused. It causes you to get nauseated, dizzy, lightheaded. So this righting reflex, if one of the bones in the upper part of the neck get out of position, see that head sits right on top of those bones. So anywhere those bones go, it takes the head wherever those bones go. Well, again, the brain's designed to be level. So what'll happen, let's say, for example, top bone went this way, the one the head sits on, and that takes the head like that. Well, now the brain doesn't like it, right? Your eyes say you're crooked, your fluid, and everything's telling your brain it's not balanced. So your brain then will instruct your body to compensate to get the head back level. Oftentimes it will actually pull down one shoulder. As a result of that, it'll pull up one hip or make one leg shorter, all about trying to get the brain level. Okay. So then what happens is you lose some symmetry in the body because one side has to stretch while the other side has to contract. And that creates a tug-of-war, which can cause spasms, pain, ache, fatigue. So if you look at this picture here, you'll see here that's exactly what's happened. So in this case, you can tell that the head has shifted off to the right, right? So the first thing starts with head-neck misalignment, which is a misalignment, a misplacement of the bone between the head and the neck. Then trying to level the brain out, you'll see it then lowers this shoulder here on this right side. So we're looking at you from behind. Then, in compensation to that, it pulls up one hip, which ultimately makes one leg shorter, which throws your whole weight distribution off. Now, if you look at what happens here, you can see right here, you get stretched muscles, contracted muscles that create kind of this tug-of-war that can cause a lot of chronic achiness, pain, fatigue. Then if you go on down, okay, there's the back pain. That's pretty obvious. Neck pain should be pretty obvious because, now you got contracted muscles, stretched muscles, that are really tight. But the weird thing is, look, it says down here, knee pain, foot pain, hip pain. Now, how does that happen? Well, your spine and your whole skeletal system's designed to work symmetrically. Okay, all your joints are set up so that your legs are the same length, your knees and your hips, everything's lined up perfectly. Well, if you throw that symmetry out, now all of a sudden one leg's shorter, one leg's longer. So like, for example, the knee joint works like this, but then if you were to pull it up, now when it strikes the ground, it has a little bit of a bend to it. So it starts to wear down prematurely. When that happens, you can start to get arthritic changes, chronic knee pain. It can affect your feet. You can lose your arches in your feet. It can affect your hip, causing hip pain, hip degeneration, all because your body's not working the way it's supposed to when it's aligned properly. Kind of like your car. When your car is perfectly aligned, you're going to get the most movement, most of the least friction, the least shaking, the least jittering. But when your car starts to get out of line, it starts to shake and starts to wear down prematurely. That's why I always say make sure your wheels are always aligned, because that's how your car runs best. Well, same with your body. As long as your body's is aligned properly, then you're going to get the most mileage. It's going to work the way it was designed, and you're going to have the least amount of these aches and pains. So, reminds me, I had a guy come in a couple of weeks ago, and he was only 60, and we're going through his initial consultation, and we're talking about, he's got neck pain, back pain, sleep, blah, blah, blah. And then he says, well, and I also have this right knee pain, but my medical doctor said it was from old age. So first of all, like I said, he's only 60. So I just looked at him and I said, your right knee hurts because of old age? And I said, yeah. He said, yeah, that's what my orthopedist told me. I said, okay, well, next time you see him, ask him how old the other knee is. I mean, if his old age at 60, for one, they're both the same age, so they should both hurt, right? Well, and actually everyone at 60 should have knee pain, right? It makes no sense whatsoever. What happened was his legs were off balance and his one knee was carrying more weight. It was wearing down prematurely, and that's what's creating his knee pain. You get the pelvis level, you get the back level, you get the head on straight, and then the whole body starts to straighten itself out, and that eliminates the knee pain. Now, sciatica. Okay, what happens with sciatica? Well, your spine's designed to be perpendicular to the ground, straight up and down, right? Well, if you get a little bend or twist in the spine, what'll happen is those discs, which are little pads, are like 70% water. Between the discs, they actually start to bulge a little bit. So that disc is like a jelly donut. It has this gel in the middle and this nucleus around it. And what'll happen is as that pressure is there, it will push that disc out towards the nerve. Then it can actually hit the sciatic nerve, or any nerve actually that comes out and goes down the leg. So going to the medical doctor, taking medications, getting shots isn't going to fix the sciatica. It might numb it, it might cover it up, but it's not going to fix the ultimate problem. Matter of fact, when we're talking about musculoskeletal stuff, neck pain, back pain, headaches, hip pain, knee pain, the one thing I can tell you is those conditions are never the result of a drug deficiency, meaning that you do not have those problems because you're not taking enough medication. So taking medication will never fix them. They mask them, hopefully, maybe temporarily, till your body gets immune to it. Then you need stronger drugs. And eventually they want to go in and give you shots. Okay, that's basically kills the nerve endings, doesn't fix anything. And then ultimately they wind up getting you to a point where, well, we run out of all the medications. Now let's go in and cut on something, right? Well, you don't have too many body parts, and you don't have a screw deficiency or a bolt deficiency. So putting stuff in the body, taking stuff out of the body isn't the problem. Okay, the problem is there is a imbalance within your spine that has created weaknesses that are now starting to holler at you. That's your body way of saying, hey, man, something's wrong. We got to get this thing fixed. It's not saying, hey, man, we need some drugs. I promise you, that's not what your body's trying to tell you. It's trying to tell you there is a weakness that your body cannot take care of on its own. It can't fix, it can't heal on its own, so it needs some help. Okay, so if we go back to the root cause, which was that head being out of balance, and that brain being shifted off to one side or another, but out of neutral, we can correct that. Then your body will literally just start to unwind. All of these compensations will work themselves out because your body put them in that situation because the head was off balance. You now put the head back in balance, then your body will take those positions out and straighten itself out, regain your posture. That's another thing. We see a lot of people as they age, they start to get stooped and they start to get leaning forward. Well, same thing is happening, but in this case, it's actually from the side. The bone moves, drops the head down. So to get the head level, it forces it out in front of you. Then the shoulders roll down, and then you start to get more and more looking like a question mark rather than an exclamation point, right? So your body starts to shrink and you start to get more stooped and your shoulders roll forward. Those are postural altercations of the body trying to keep the brain level. If the head moves down like this, the only way to get it back level, it has to push it out in front of you until it gets the brain level. And then when that happens, everything starts to compress, starts to add pressure to the disc, which can cause the disc to degenerate. You lose the curves. When you have good curves, you have good flex in the spine. When you start to lose curves, all the weight of your head, the rest of your body starts to put pressure on those discs. So they start to get smaller, thinner, they degenerate. That can ultimately affect the nerves going down the arms, the nerves going down the legs, and cause arthritis, osteoarthritis, degeneration, pretty much all the same thing, but joints get inflamed because they don't work right. So that's what arthritis is. Arthros joint, itis is inflammation, and joints get inflamed when they don't work properly. And the only reason they wouldn't work properly is because you have some posture altercations. So that's what needs to be done. You need to check to see what could have thrown your posture up, what could have thrown the upper head out of balance, what type of misalignment do you have in the top of the neck that has created these compensatory changes, and your body's having a hard time getting over it. So what we have to do is we got to take very specific x-rays. We got to see exactly how the position of those bones are in the upper neck. We need to make them correct. Well, we need to correct them, get them perfectly back positioned underneath your head so that we make sure that the head neck alignment is neutral, is perfectly straight. Then your body will just unwind on its own. And those chronic conditions, neck pain, back pain, arm pain, leg pain, hip pain, knee pain, foot pain, all of those things then start to heal because we take the stress out of the body. Then the body quits hollering at you, telling you something's wrong because the body's in a more neutral position, and it's not constantly, there's not this chronic tug-of-war from the right side to the left side. Your joints are all balanced, working the way they're supposed to, not working abnormally, so they don't wear down prematurely. So if you suffer from chronic back, chronic neck pain, musculoskeletal pain of any kind, shoulder pain, back pain, hip pain, leg pain, it's only served you well to get that area checked by someone who knows what they're doing, someone who specializes in making sure that the spine is perfectly aligned, that the head-neck relationship is perfectly lined up as it should be. And then I think you'll be amazed how quickly, once you take that stress off of your spine, how quickly your body can start to heal and things can start to go back to normal. So if this makes sense, please like it, please share it, because back pain is the number one pain problem in America. And I think A lot of people are chasing the symptoms with drugs and shots and potentially surgeries that aren't very successful. And so if you know anyone like that, please share this video with them because hopefully they can get some relief and quit suffering and not have to take the drugs that have all the side effects and kill nerve endings and potentially go into the night. So if this makes sense to you, please like it, please share it. More people need to know. And if you comment on this video, I can find a doctor near you. If you live in the Charlotte area, our office is right off Arrowwood Road. We'd love to help you. If not, comment you need some help, and we will find you a doctor that can help you. All right. I hope you like this video, and we look forward to seeing you on the next episode of the Best Kept Secrets in Healthcare. Have a great day.